My name is Dr. Haggard, and I am excited to share some new science with you that was published just last month. Finally, the proof that I have been waiting for my entire career. By a show of hands, who believes type 2 diabetes is reversible? In 1995, an article was published in the Annals of Surgery entitled, "Who Would Have Thought It? An Operation Proves to be the Most Effective Therapy for Adult-Onset Diabetes Mellitus." These doctors reported more than an 80% cure rate of diabetes after 10 years with gastric bypass or stomach stapling surgery in the American Journal of Clinical Nutrition. The correction occurs rapidly. Patient 1 had a fasting blood glucose level of 495 on the day before surgery, despite giving insulin. By the end of the first day after surgery, her fasting blood glucose level fell to 281. By the 6th day after surgery, she no longer required insulin. The Journal of the American Medical Association, or JAMA, reported gastric banding cures type 2 diabetes and fast. The decrease of blood sugars into the normal range was seen within 7 days. This article, published by the National Institutes of Health, states quite plainly the potential cure by writing, "Bariatric surgery causes marked weight loss and complete remission of type 2 diabetes in most patients." Was it the surgeries or the diet changes associated with the surgeries that cured the type 2 diabetes? In 2013, 10 patients ate less for 10 days and then 6 weeks later had a stomach stapling surgery. Researchers compared their weight loss and blood sugars during both and found eating less was more effective for both weight loss and blood sugars than the surgery. In 2011, researchers placed 11 type 2 diabetics on a reduced energy diet and their diabetes reversed within 8 weeks. In 1916, Dr. Joslin thought it was so obvious that undernutrition could reverse diabetes, he wrote that temporary periods of undernutrition are helpful in the treatment of diabetes will probably be acknowledged by all after these 2 years of experience with fasting. So what happened from 1916 to now? Insulin injections became available in the 1920s, and type 2 diabetics no longer needed to change their diet. Insulin became the alternative to correcting the disease with lifestyle. From the American Diabetes Association's 2014 guidelines, it reads, "Due to the progressive nature of type 2 diabetes, insulin therapy is eventually indicated for many patients with type 2 diabetes." So today, lifestyle change is regarded as the alternative. Food rationing, especially sugar, represented by the dotted line in this graph, during war times showed a sharp reduction in deaths due to diabetes, not once, but twice. In 2014, researchers found that insulin resistance is associated with enlargement of fat cells. So it should not be too surprising that although stomach stapling and gastric banding cured diabetes, liposuction did not. Decreasing the number of fat cells and fat mass alone will not achieve the same metabolic benefits of weight loss because you have not affected the cell size of the fat cells remaining, especially in the liver where you cannot perform liposuction. Liposuction did not cure type 2 diabetes because it did not alter the insulin sensitivity enough of the people who received it. However, once there were people reversing type 2 diabetes to study, researchers described more specifically how people get and reverse type 2 diabetes. Fatty liver happens before type 2 diabetes begins, typically 18 months prior to developing diabetes. It's like a long, silent scream from the liver. And when diabetes reverses, the fat in the liver reduces. These red circles are the same size, and there is an average of liver volume reduction of approximately 30% when diabetes reverses. Most of this liver fat loss, around 80%, occurs within the first 2 weeks with significant weight loss. Type 2 diabetes reversal occurs when there is improvement in liver insulin sensitivity after weight loss. How do you get fatty liver? High insulin levels and carbohydrate excess. We know that type 2 diabetes and obesity are related. Obesity is a primary risk factor for developing type 2 diabetes. This is data published in September of 2015 that shows the more overweight you are, the higher the risk you have for developing type 2 diabetes. Also, where you store your fat increases your risk for diabetes, and that upper body fat is worse for developing diabetes than lower body fat in women and men. Again, particularly fat in the midsection puts people at higher risk for developing type 2 diabetes. Over the years, diabetes has been classified different ways because of the increasing overlap seen in the disease. It started with juvenile or adult onset in the 1970s. Then it was classified as insulin dependent or insulin independent, since children were developing type 2 diabetes. In 2000, another division was proposed, LADA, or latent autoimmune diabetes of the adult, because now the adults are getting the juvenile version of the disease. I have a new, simpler, and more effective way to classify diabetes. We call the previous type 1s insulin deficient and the type 2s insulin resistant. And then when either of those types of diabetes have progressed, usually because of the treatments that doctors give these patients, we have doctor-induced double diabetes. Let me explain. In insulin deficient or type 1 diabetes, people do not make enough insulin. Their fat cells are empty without the insulin. Add insulin and you will fill the empty fat cells, just like this before and after picture of one of the early type 1 diabetic patients administered insulin in 1922. The addition of insulin added fat to her body quickly. In the opposite scenario, when someone starts to get type 2 diabetes, they become more overweight, make higher and higher levels of insulin, and become more and more insulin resistant until they have full-blown type 2 diabetes. In insulin resistant or type 2 diabetes, people make too much insulin, and their fat cells typically become full and ignore insulin. This condition is regarded as a relative insulin deficiency since there is plenty of insulin present, but the cells are not responding. That is the reason type 2 diabetics will experience significant unexplained weight loss even though they eat and drink more initially like the type 1 diabetics do, even though they have as much or more insulin than most non-diabetic people. Can anyone relate to this? If you do not change your diet, you will usually need to add more insulin to treat the symptoms until you can achieve superhuman insulin levels with medications, levels that the body would never be able to make and maintain on its own. In order to force more fat in the fat cells, Although these insulin deficient and insulin resistant types of diabetes are at opposite ends of the disease spectrum, when insulin deficient diabetics take excess insulin and become overweight, they can become resistant to insulin while simultaneously being deficient in insulin without the medication. Likewise, insulin-resistant diabetics can burn out their pancreas's ability to produce these extreme levels of insulin and become deficient in insulin production while still having their full fat cells resistant to insulin. This is the continuum of how people get and reverse diabetes. Normal people are on the left, showing low levels of insulin and blood sugar, and then they gain weight and have incrementally increased insulin levels during progression of the disease continuum, until finally their pancreases burn out. So, the underlying problem for type 2 diabetes during most of the disease is elevated insulin levels, and the elevated insulin levels cause blood sugar to rise. It is only in the end stages of double diabetes where eventually the pancreas burns out and cannot continue to make insulin. This is what I mean when I say double diabetes. But what if I said type 3 diabetes is likely to be the next major epidemic that we face? You might be thinking, type 3 diabetes? Is that such a thing? You may know type 3 diabetes by another name, Alzheimer's disease. In 2008, researchers reviewed the evidence and concluded that the term type 3 diabetes accurately reflects the fact that Alzheimer's disease represents a form of diabetes that selectively involves the brain. In 2013, researchers published a meta-analysis involving a total of 28 studies in the Journal of Diabetes Investigation and showed a 56% increase of Alzheimer's disease in diabetes patients. The problem is Alzheimer's disease is not just about memory loss. It kills people and moved to the 6th leading cause of death in 2014. 1 in 9 people aged 65 and older has Alzheimer's disease. This number is expected to rise to 1 in 4 within the next 20 years. About a third of people age 85 and older have Alzheimer's disease. The American Diabetes Association predicts that in the next 15 to 35 years, type 2 diabetes rates will double and triple in our country, so that by 2050, 1 in 3 Americans will have type 2 diabetes. Since gaining fat and diabetes are linked, gaining or not losing fat is a hormonal problem. Specifically, too much insulin causes type 2 diabetes and obesity. Not too much blood sugar. It's a huge difference. However, most doctors will tell you that lowering blood sugar is the goal of diabetes and weight loss treatment. How do they lower blood sugar? By giving insulin, which again in the 1920s was the alternative approach to lifestyle changes. If diabetes is caused by too much insulin, why would conventional doctors give more insulin before the pancreas burnout stage or double diabetes stage? Conventional doctors say that high blood sugars and diabetes cause the complications of diabetes. So if they can treat the high blood sugars, they can avoid the complications of diabetes. The problem is that this is simply not true. In the advanced study of more than 11,000 diabetic patients with either tight or less tight glycemic control represented by the lower hemoglobin A1C, there was no significant benefit on major macrovascular events or deaths after 5 years of follow-up. More shocking, though, is in the ACCORD study of more than 10,000 diabetic patients. Patients, again, either had tight or less tight glycemic control with medications, which led to an average hemoglobin A1C of 7.5% in the standard therapy group and about 6.5% in the tight control group. The study was stopped early due to a 22% increase in deaths of the tight glycemic control group. The intensive therapy group was switched to less tight glycemic control after the study was stopped. Also, 28% of patients in the intensive therapy group gained more than 20 pounds because all that blood sugar had to go somewhere. Did anybody's doctor discuss this study with them and say, let's not focus too much on lowering your hemoglobin A1C? This study of almost 28,000 patients showed when medication regimens were changed to include insulin, their death rate also increased. In this 2011 meta-analysis in the British Medical Journal, researchers concluded the overall results of this meta-analysis do not show a benefit of intensive glucose lowering treatment on all-cause mortality or cardiovascular death. In 2015, this study could find no significant association between hemoglobin A1C lowering and a decrease in clinical outcomes, thereby questioning the use of hemoglobin A1C as a surrogate outcome for type 2 diabetes-related complications. This is analogous to having a leg infection. If you have a leg infection like gangrene, that infection will also cause a fever. Treating the fever with Tylenol, for example, will improve the fever, but do nothing for reducing the cause of the disease. Treating high blood sugar with insulin or oral hyperglycemic agents only treats the symptoms and actually makes the disease worse. For example, a typical type 2 diabetic is starting to have symptoms or finds that their blood sugar is elevated on a routine blood screening, so their doctor puts them on diabetes medication, either oral or injectable, and gives them a blood glucose monitor and teaches them to measure their blood sugar. And with the medication, their blood sugar improves. But over the years, they need to increase their dose of medicine or add additional medicines to do the same thing that the first medicine was doing. I contend that this patient is sicker than when they started the medication, and it's a formula to get fatter while never addressing the cause of the disease. So the diabetes, just like the leg infection, gets worse because the doctor is only treating the symptoms of elevated blood sugar, not the cause, which is too much insulin. From drugs.com, certain diabetes drugs result in added pounds. Diabetes drugs, Diabeta and Glucotrol, can lead to weight gain and increase insulin production. Injectable insulin can also lead to weight gain. Actos and Avandia may lead to weight gain too. There is a pattern here in diabetes drugs. And drugs can have serious adverse effects, such as emergency department visits, which in 2011 there was an increase of 84% from 2005. And death. The FDA cites that over 98,000 people died from adverse drug reactions in 2011, making adverse drug reactions the fourth leading cause of death of according to the FDA. These are the reasons why you don't hear about people who developed type 2 diabetes, started their insulin, and in 2 weeks they were completely better. Or they started oral medication, and in a month they are better and off all medications. In Diabetes Forecast magazine, a common question was asked. I was recently diagnosed with type 2 diabetes, started medication, and feeling better. Should I continue taking my medication? The smiling pharmacist answers, unfortunately, the medications that are used to help manage blood glucose in people with diabetes do not fix the underlying causes. As a result, the medications generally cannot be stopped without losing glucose control. Lifestyle changes can alter the need for medications and sometimes enable people to stop taking them altogether. As Upton Sinclair put it, it is difficult to get a man to understand something when his salary depends upon his not understanding it. How can we move towards more cures for type 2 diabetes? Start by studying the cures that we know to clearly understand what causes diabetes. Simply dividing the treatments for diabetes into which ones have been shown to cure type 2 diabetes and which ones do not, we can see perhaps the reason reversing diabetes is so rare. Most of our current treatment protocols, research, and treatment goals are therapies that have not been shown to cure the disease. When people had weight loss and reversal of their type 2 diabetes, they restored their insulin sensitivity. So weight loss and restoring insulin sensitivity should be the goal for people with type 2 diabetes. Yet most of our treatments make blood sugars better, but type 2 diabetes worse. We are moving towards the no cure side. In 2014, Diabetes Care researched how many people were actually reversing their type 2 diabetes, and they found that it was very rare. Over the course of 7 years, it was only 1.6%. The researchers concluded the chances of dying were higher than the chances of any remission, which is difficult to imagine. People are more likely to die with diabetes rather than to figure out a way to reverse their diabetes. Why is remission of type 2 diabetes so rare? I propose that it's because for the last 20, 30, even 40 years, diabetes treatments have been focused on the wrong target of reducing blood sugar instead of reducing insulin resistance. Obesity and weight gain can increase risk for diabetes by greater than 90-fold. The American College of Nutrition wrote in 2003 that weight management may be the most important therapeutic task for type 2 diabetic individuals. Diabetes has reached epidemic proportions worldwide during the past 30 years. And this trend shows no sign of slowing down. A new study was published in September 2015 that showed the prevalence of total diabetes increased significantly in every age group, in both sexes, in every racial, ethnic group, by all education levels, and in all poverty-income ratio tertiles. Why is this happening? In the American Diabetes Association, What Can I Eat? Diabetes Guide to Healthy Food Choices, it states, diabetes is a lifelong disease that causes blood glucose levels to go higher than normal. There is no cure, and this is simply not true. In other words, you should get used to it. Who here doesn't want to get used to it? Used to checking your blood sugar the rest of your life. This is also from the American Diabetes Association, who agrees with their stated fact. We've seen it's reversible. So to say that diabetes is a chronic progressive disease is simply not true. And using medications to lower blood sugar by increasing insulin or making insulin more efficient is crazy. Knowing what you all now know, who thinks injecting insulin is crazy for most type 2 diabetics long term and not a good thing if there is another way? Studies have shown that people with type 2 diabetes that lose weight short term tend to not maintain their improvements, such as this study following 51 type 2 diabetics that lost significant weight during a 12-week intervention period. The researchers concluded it was the intensive weekly contact with a health professional that facilitated the success. Statistically speaking, you need to assemble a personal team to improve type 2 diabetes. Research consistently shows 3 key factors in improving type 2 diabetes. First, the shorter the duration of diabetes, the better. Second, the younger the person, the better. And third, the type 2 diabetes does not require insulin yet to control blood sugar. So what does that mean if you have type 2 diabetes? Don't wait. Taking action now will be easier and more effective compared to if you wait. Making changes is never easy, but there is an approachable path for improving type 2 diabetes based on learning an older science of nutrition to identify healthy foods and sustainable lifestyle habits. Thank you, and please spread the message.